This video includes basic information about the use and care of mechanical lifts in agencies. Subsequent videos will include one demonstrating the use of the ceiling lift as above, the one demonstrating the use of the maxi lift, and the one demonstrating the use of the standing and raising lift. These are three pieces of equipment owned by Algonquin, but you will see variations from different companies in the agencies where you're placed clinically. What's important to know that manufacturers provide instruction for how to clean and care for the lift, but over and above that, the agencies where you are placed clinically will have policies and or protocols about how and when and with whom to use these lifts. It's very important that you are familiar with the agency policy and protocol regarding that. In our labs at Algonquin, depending upon your program, you will have the opportunity to practice using the lifts. However, what we also encourage you to do is to take advantage of being the patient when the lifts are being practiced with, because it will give you a true perspective of what your client is actually going through when they are placed in a lift sling or when they're moving from sitting to standing as they would be with the Encore lift. We encourage you to have the opportunity to practice that. You will receive instruction, theoretical knowledge, and time to practice using these lifts in the lab. However, most agencies require additional training specific to the agency when you are placed there clinically. So for example, on your first or second clinical day, you will have an orientation to the unit and the agency, as well as an in-service with training about how to use the lift. What is most important is mechanical lifts should always be used with two individuals, one operating the lift and one operating the care and safety of the client. Working in collaboration, those two healthcare professionals ensure that the client is fully aware of what the process involves regarding the lift. What's also important to know is that when you're out in clinical, agency policies usually demand that one of the two individuals using the lift is an employee of the agency itself. So for example, if you are placed on a clinical unit, you cannot ever transfer a client with your instructor from the college or with a student. The transfer, the use of a mechanical lift always requires an employee. After each use of a mechanical lift, it's important to clean the lift using disinfectant wipes, as per the agency protocol, identifying what type of wipe to use. It's best to clean the lift immediately following the transfer of a client. Then it is for sure clean for the next client being used. In terms of the straps or the slings, as on these, the canvases, most of the time only when they are soiled are they cleaned, and again that would be as per the agency protocol and as per the manufacturer's instruction. The lifts, these two particular lifts, as well as the ceiling lift, have handheld controls as well as controls on the actual lift themselves. They also have an on and off switch. On is green and off is red switch. And in addition, they have rechargeable batteries. And the batteries are typically used and can be used for up to 8 to 12 hours. They are extremely heavy, and so make sure that you note in your agency where the charging station is. Most have, although this doesn't, an LCD display which identifies how much charge is left in the battery. Okay, but the batteries, there should always be a spare one on the charging station. Just fits securely in place like that. In addition, most lifts have emergency ability to stop the lift and lower the client at any time, and it's important that this content is reviewed in your in-service instruction. As mentioned at the beginning of this video, we have created 3 individual videos where demonstration in terms of use of the ceiling lift, the maxi lift, and the stand and raising lift are available for your viewing. In addition to your preparation for lab, we encourage you to utilize these videos repeatedly to prepare for your clinical experience.